There we go.
There we are. Okay, now it is my great privilege and pleasure to welcome our guest speaker, Dr. Jeeves Wijesuriya, who spoke at our live meeting, and he's come back for more. And he's going to introduce the session. He's going to be able to answer, we hope, some of the questions that you've submitted in advance. And then we're going to have a live question and answer session. I say live, it's for questions that you want to submit. But can I put in a plea that you use the chat function, which is down at the bottom of your screen, to put your questions in so everyone can see them. And what we find inevitably is there are questions we can group together. They're along similar lines, and it helps rather than have 20-something of you all try and put your hands up at once. So that would be very handy. Without further ado, I'm going to pass you over to Dr. Jeeves. Thank you very much. And if you could spotlight him and not me, great.
Hi everyone. I'm Jeeves Wijesuriya. I'm a GP. I've spent actually the last 16 years working and training in East London in Hackney, and recently moved to Nottingham. So now in Nottingham at practice in the city centre here. I'm also the clinical advisor to the vaccination and screening team over at NHS England, amongst a few other jobs. But I am absolutely delighted to be speaking to you here again today, and I'm very grateful to Sharon and Tony and the team for having me back to talk to you. It was a pleasure to speak to you last time. It's worth saying I'm going to try and keep my opening comments really quite brief and stick to just as much as I can a little bit of why I'm doing this talk and a little bit around the facts and the numbers associated with it. I've got the questions that Sharon has very kindly sent me that you've all submitted, and I've sat and I've tried to make sure I have an answer to all of those questions, and I'm going to try my best to make sure I give you a good, clear answer to each of the things that you've sent in, and I'll try my best to take as many questions as I can afterwards as well. It's worth saying that the reason I do this particular job, the reason I do not just the GP job, but the vaccination clinical advice job, is because, after many years in Hackney, I had a cohort of patients that I used to look after specifically that were mine. And they were a sort of largely housebound elderly population. They were a cohort of patients that I used to visit regularly. I used to speak to them. I used to speak to their kids. And I looked after their health and tried my best to keep them out of hospital. And one of the things that became clear, certainly during the pandemic, but also immediately afterwards, was the incredible risk that they had, particularly during the winter, and particularly from things like flu and COVID. We know that there are certain members of the population who are more at risk than others. We know that for most people, flu or COVID can be unpleasant. But we know that for people over a certain age or people with certain chronic health conditions, actually it can be dangerous. And we know it can be potentially life-threatening. Last winter, there were 14,500 deaths from flu. 50,000 people were hospitalized, of which 10,000 were children. We know that last winter, 140,000 people were hospitalized with COVID. What's important to note within that is that we know that vaccines prevent not just death, but hospitalization, which for some of our older population is so important because we know the risks of being in hospital. Ending up in hospital, ending up with an opportunistic infection, that can mean they end up being very, very unwell, perhaps with something that they didn't originally go to hospital with. Vaccines last year presented 25,000 people being hospitalized. That's the data that we have around this. And part of the reason I come to speak to you today is specifically to talk about the importance of not just flu, but COVID vaccination this winter, particularly for yourselves. I say this because particularly with my frail visiting list that I had in Hackney, a number of them struggled to make it through the winter period. And that was because of the impact these infections can have. And I feel it's important now to do everything I can to try and give you the information to make your own decision about what you're going to do this winter, not just in terms of your general health, but also to get winter ready for this period, for COVID and for flu. And there are many things also that I think are worth talking about in terms of winter. One of those things is going to be about trying to eat well, trying to make sure that you're eating fresh or healthy food if you can. And I know there are some questions about this that you were submitted, and I'm going to come on to those. Part of it is about trying to keep warm where you can. And then one of the biggest things that I think it's important to mention as well is about loneliness, which I think we don't talk about enough, and about the impact of isolation. And I really want to emphasize how great it is that you have come to events like this and that you use some of the events that are put on by groups like Age Concern, because they are really powerful ways to meet and socialize with other people, to have conversations and to be stimulated. Because at a certain point in our lives, it's about how much we do. That is maintenance of our, not just joints, but our minds. And so my particular plea to you, because I think you know about the trying to eat well, and I think you know about the trying to keep warm, which is so difficult in this time, I know, but also particularly around being able to engage and socialize with one another. And just to say that one of the ways to do that safely, again, invariably that I have to mention, is making sure you're winter safe, to reduce not just the risk of you becoming very unwell, to improve your recovery time, but also reduce your risk of passing infection on, is to make sure that you're vaccinated. And I'm going to come on to talk about some of the other vaccines as well, like the pneumococcal vaccine or the shingles vaccine as well, because I know there were questions about those. But I really wanted to emphasize those things particularly. Now, we know that our vaccines are safe. They've been reviewed by the MHRA, which is the Medicines Health Regulatory Agency, who basically look after the safety standards of every medication and have been through rigorous tests of our current vaccines. And the reasons that we are giving you a booster vaccine this year, both for flu and indeed for COVID, is because we look at the strains of that virus that we believe are coming up this winter. So whilst you might have had previous vaccines, they may not be the most suited to the current infection that we believe is spreading in the winter period. So we know, for example, that the strain of COVID that we're seeing at the moment, which we know is particularly harmful to patients of a certain age or patients with certain health conditions, is best combated by the vaccine that we are now administering as the booster this winter period. Similarly, with the flu, we've looked at the trends of flu, both in Australia and internationally, and what we think is coming this winter. And that's why the booster flu vaccine that you're getting this winter as well is specific to the bugs that we think are prevalent in this winter period. So that is why those things are available. That is why I think we're talking about those things. It's important to note that we don't think, people are protected enough, particularly in London. We fall well behind the national average for vaccination and uptake, both of flu and of COVID. We sit at 25 and 27% currently in London, well behind the 42% that we're at already at this point nationally. And so that is part of my plea to you, is to make sure that you're safe, because, unlike other parts of the country, we are quite densely populated, which means you are more likely to interact with other people and more likely to contract one of those viruses. So it's particularly important here, yet our numbers perhaps don't reflect that. Now, it's worth saying that many people have completely understandable and legitimate fears about vaccination and about healthcare in general. I know that for many, it's difficult to get access to a GP and a GP appointment. I suspect that's why I'm here talking to you now, to try and give you some access, but also partly because I know that many of you will have a natural and understandable mistrust of healthcare bodies, mistrust of organizations. I think it is completely legitimate for many of our particularly minority ethnic communities to be anxious about going and having a medication that they may not have had before. But that's why I'm here, to give you the information, to try and reassure you and enable you to make the best decision you can make for yourself. Now, I promised that I wouldn't go on, and I'm hoping I've not reached that point yet. But that's kind of the crucial information I wanted to share with you. And that's probably, my kind of take-home messages for you this winter as we kind of enter that period. I've got a series of all the different questions. Tony, I'm in your hands as to whether you'd like me to move to answering some of those, but I think probably those are my take-home key messages for you as we come into this discussion.
Yes, please. And I think you need to stick with this theme all the way through, but I think go straight into the questions that have been submitted. I'm about to put something into the chat to remind people that in the next part of the meeting, we'll be taking questions, as it were, from the floor, if you don't mind that expression, and to ask you to put your questions in the chat. But Dr. Jeeves, fire away with the ones that people have been sent already. Thank you.
Fantastic. Thank you so much. And it's great to see so many of you, by the way, here on the kind of cameras and doing things in the background. That's great. So one of the first questions we had were, if you've had COVID recently, should you have a booster jab, or are you already immune? So it's important to say that if you're eligible, it's really important to top up your protection, because one of the things we talked about is that you may not have had this strain that we think is present in the winter period. And that's what the booster is there to protect you from, both with flu and indeed from COVID. But I know this question is specifically about COVID. We usually advise you to wait 28 days after an infection to get the booster, because it gives your immune response a chance to develop the antibodies that we're trying to cultivate with the vaccination. So normally we would advise 28 days between having COVID and getting the booster jab. You may well have a degree of immunity from having the infection, but it may not be immunity to this specific strain. And that is what the booster for the COVID does, and that is what the flu jab does, is give you immunity that specific strain. And that's what's so important about that. So in short, yes, you should have a booster jab. You have immunity, but not necessarily to the thing that we are trying to protect you from. And 28 days normally we advise after infection before getting your vaccination. How often should a 72-year-old require a COVID-19 vaccination? So generally, it will be when you're advised that you might need one by NHS England. Now, one of the things we try to do using your GP record is, if we identify you being over a certain age as being at risk or having certain health conditions, we will write to you and remind you that you are eligible for a vaccine. That process is not 100% foolproof, because our access to GP records isn't always amazing, to be fair. But it's really important, if you are prompted, it's really important that we make sure that we get you protected. Now, usually this is mapped to strains, and I know we're 6 months on from the last booster, but we are looking at this winter period, the strain that we think is coming over this winter period. And that is why I think we are asking for you to be vaccinated now. If we perceive that same risk in the future, we will come back to you, because one of our priorities is particularly keeping this group, this cohort that's particularly at risk, protected. And that's why we're offering that vaccine now, because we know that disproportionately the worst outcomes happen to people at a certain age and with certain health conditions. Okay, so that's why this top up is available. I am immobile at present and living in Barnet, and I cannot go for my flu jab and COVID booster. I've inquired, but no one seems to be able to help me. Who can I contact? Well, firstly, you can call 119, which is the COVID hotline, although slightly less hot than it used to be, perhaps. And that line via 119 will help get you booked in and help get you sorted. You can go on the COVID UK website, and they will help you to book in online as well. That's another mechanism. You can use your GP as a source of information, and you can contact them as well. Now, it's worth saying that your GP can identify you as being housebound on the list, which means that they're able to come to you to do the vaccine. So that may be a really good way of organizing this. And usually most areas have something we call a roaming service that visit people to give them the vaccine. But we try and prioritize and keep that service just for the people that would really struggle to get in, so that we can use that service responsibly and look after the people that most need it. So I'd really encourage you to use one of the mechanisms I've described to you, and that should help you to access what you need. For someone living in Barnet, if you've not been able to get any information via your GP, you can contact NHS Northwest London's ICB. Now, what I'll do is I'll put their details and their number, which I've dug out for you for some reason, in the chat, which I'll just put there, and that's specific to Barnet, if that's helpful to you. So that's some contact details to help you. What are the advantages of having the COVID vaccine? I've talked about this quite a bit, but effectively, it's about reducing your risk of serious illness. It doesn't mean that you won't necessarily get the flu or COVID if you have the vaccines, but it may affect quite significantly the seriousness of the infection you have. It can speed up your recovery time, and it can reduce your chances of passing the infection on to someone else. And those are the reasons why we use these vaccines to keep tens of thousands of people out of hospital. It saves lives. We know that it gives you better protection than any immunity that you gain from a previous infection. We know that vaccines are more effective than that, and it can help you protect your family and other people in your community. So multiple reasons for why these are important. And they're a great way of getting yourself ready for winter, prepared for that winter period. And we're using this phrase winter strong, which really, I think, tries to capture what we're trying to achieve. I had long COVID for 9 months last year, and I was advised not to have another COVID booster while I was ill. I'm better now after a very unpleasant illness. Should I have another booster? Well, firstly, I'm really pleased to hear that you're feeling better. There are people that get COVID and have symptoms that last for really quite some time. And that is a really difficult thing, and something that we try to combat and try and prevent with things like vaccination. I think it's great that you've recovered from that, but it's really important that actually, once you've recovered, that you do make sure that you have the booster to give you protection against potentially getting it again. And that is part of the reason we're advocating doing that. Now, it may be that you need to speak to your GP or your healthcare professional to discuss that and your specific needs. But it's important to say, that the booster remains a really effective way of preventing future COVID vaccination, particularly with this strain coming up. If you are currently unwell with COVID, it's really important to wait till you've recovered to have your vaccine. We talked earlier about, many areas have this 28-day period that they suggest being important. And it's really important that you try and avoid giving the infection to other people while you have it, if you can. Okay. Which vaccine is the best one for older people? Pfizer vaccine was very popular. Do we have a choice? We often have this discussion now because of the various brands of COVID vaccine. It's really important to say all COVID vaccines that we offer have been specifically ones that are advised for use this winter by experts in the JCVI, which is the Joint Committee for Vaccinations and Immunizations, who are experts looking at this data. These vaccines have been tested with rigorous standards, and they give good protection against the virus. Currently, it's the BA 2.86 Pirola variant, which is the big risk that we're looking at this winter. And we know that the vaccines we are offering, we're currently the primary one being the Comirnaty XBB 1.5 vaccine, for those interested in the specific numbers, which baffle me in terms of how they come up with these clearly very detailed and interesting names. That's what's being offered first line as being particularly protective against this variant that we know is out there. So that is the one that we are advocating because of its protectiveness. If one becomes very ill anytime a flu jab is taken, should the person continue to take it or should they stop? There is a lot of pressure to take the flu jab, and at times they feel like no one is listening to them. Well, look, firstly, it's important to recognize that, there are impacts of having things like the flu jab. You will get things like a particularly sore arm, and some people find that they do get kind of cold and flu-like symptoms, and they can find that they get quite a bit of pain when they have the vaccine itself. But it's really important that we recognize that almost everyone can have the vaccines that we are talking to, and there are things we can do to protect you from those initial side effects. We know that those initial things are generally quite short-lived, and we think about that in terms of benefit risk with preventing the infection itself, which can be so dangerous. Now, there are a number of things that you can do to help you with that sore arm, particularly in those initial features that people sometimes get, like using paracetamol or ibuprofen before you go and get your vaccine to help with that soreness as well as afterwards. Some people find that using a hot water bottle on their arm or an ice pack on their arm can be really helpful as well. And just making sure that they're keeping warm in that first 24 to 48 hour period can be really important too. There are, of course, people who might have allergies to elements, but usually to any of those ingredients, but usually we try to make sure that if you are allergic to any of the contents, that you will not have that particular type of flu vaccine. And it's always worth having a conversation if you have any worries or doubts about that. Some people have had the latest COVID-19 injection and a flu jab on the same day. I know of several people who've had both, and they felt unwell for the next few days. So it's worth saying, yes, we can co-administer flu and COVID. And JCVI have specifically looked at co-administration, giving both vaccines at the same time to see if there is any risk or reduced impact or reduced benefit. And actually, they are encouraging people to get both in the same appointment. One, because it's more likely they will have both of those vaccines when they have them together, but because we know that it's safe to have both. You will still, of course, get those sore arm side effects and that initial period of kind of perhaps feeling a bit sore from having them done. But again, this is about preventing serious illness and feeling incredibly unwell and potentially being hospitalized in the future. So it's about trying to get you protected. And again, doing those things to manage those side effects initially to help you come through them. But absolutely, we'd encourage you wherever possible to get both together. You can, if you feel uncomfortable to do that, have them separately and book in to have them done separately. But there are obviously many schools of thought that suggest it's better to, oh, my watch there, that suggest getting them out of the way. I myself have had them co-administered, and I had a sore arm for about 2 days and took some paracetamol and ibuprofen. And actually, I think I preferred that to having 2 episodes where I had a sore arm by having one. But again, the choice is entirely yours, and it's completely reasonable to take either decision, but know that both are safe to do. I've had both COVID and flu vaccinations in September. Will I need more vaccinations for the new year, as I'm planning to travel? So you should get a message about your eligibility. If you've had the jab that's required for the winter period, then you should be protected. It may be worth checking to make sure you've had the winter jab specifically, as I'm not sure of the specific vaccination that you've had, my friend. What are the long-term side effects of the COVID vaccine? It's worth saying that they actually have an incredibly good safety record. All adult flu and COVID-19 vaccines are given by injection into the muscle of the upper arm for patients in this age group. Most side effects are actually mild and only last for a day or so. They're usually a painful, heavy feeling or tenderness in the arm where you've had your injection. This tends to be worst in the first couple of days following a vaccination. Some people do report that they feel a bit tired for 2 days. Some people describe getting a headache or general aches and pains, a bit like the flu itself, for 2 days. And, if you find that you get anything longer than that, it's always worth seeing the GP, because it may simply be that you have, got a cold or a flu itself. And often that's the case when you walk into the GP to get the flu. jab because you're surrounded by people with the flu, which is one of the challenges of just being in GP, really. How long is the protective effect of the COVID vaccine? Well, we know it's given to top up the protection in those at higher risk to help prevent them from some of the outcomes we've already talked about during the colder months. It disproportionately affects people in older age groups, particularly those in care homes or those with underlying health conditions. It's a top up that we hope will last for the rest of the winter period and certainly into the new year. I cannot tell you when the next booster might be because it will be based on the data we get about what bugs we're seeing in the hospitals and in the communities as we test. And we would offer another booster only when we feel that that is warranted, when that is needed, and we're seeing those numbers and we feel it's not necessarily protected by what you've already had. Can the COVID vaccination affect other health risks in older people aged 80 or more? I hear there is a risk of clotting. Is there a good immune response by the body to both vaccinations when you're 80 plus and have had these vaccinations before? So it's worth saying that specifically, we know that above a certain age, we know this is particularly protective. So actually, being 80 plus particularly is exactly the group of people that we are trying to protect. And that is why we are offering these particular vaccines, because we know that the outcomes for patients at this biological age are greater. And that's why we are offering them. The risk of clotting. So it's worth saying there was a previous vaccine that we were using in the initial period that had a slightly increased risk in younger people, not in our older adults. And actually, we didn't offer that particular vaccine to younger people for that reason. But we do not see that increased or even slight increased risk in our older adult population. You appear to be significantly more robust than our younger generation. And I don't know what else to say about that. Then clearly you're built differently. And, you know, I don't think that's necessarily a bad thing. But there is not a risk that we flagged in the newer vaccines for that. So I hope that that's reassuring. What is the reason why older people are asked to come for flu and COVID vaccine? Is one not enough? Yes, we basically ask these people because we know they are at higher risk. That is why, purely for that reason, higher risk, not just of, you know, really bad illness, risk of hospitalization, risk of death. Those are the reasons we offer these vaccines. We offer them because they're protective against the most harmful strain that we see coming up in the winter period. I wish we could give you one jab that had them both in it, but we can give you two jabs at the same time. It is unfortunately two different illnesses and two different vaccines for that reason. I suspect there'd be a Nobel Prize in the offing if we could get it all done in one for someone. My wife and I are close to 80. How important is it that we get the shingles vaccination? It is worth saying shingles, and I suspect there will be someone in this group that may have experienced this. There was when we did the face-to-face talk, and I think they were the best advert for why getting the shingles vaccine is important, because they described this incredibly painful rash that people get with shingles, lesions across the chest. It is very painful. It is reactivation of the same virus that kind of causes like chicken pox effectively. And it is a burning, painful infection when it comes on. Eligibility for the free vaccine on the NHS runs up to 79 years for those that are not immunocompromised. So please do come forward as soon as you can. So I would encourage this person and their wife to please do get the shingles vaccine, because it is such a miserable illness. And if we can prevent you getting it, we ought to. At what age can I get the shingles vaccine? Well, it helps protect against shingles. It's recommended for people at higher risk. So all adults turning 65 from the 1st of September of this year, those aged 70 to 79, and anyone aged 50 years and over with a severely weakened immune system. So just to say that again, that is all adults turning 65 from the 1st of September 2023, those aged 70 to 79, and those aged 50 and over with a severely weakened immune system. So if you fall into any of those categories, please do go and get your shingles vaccine. And if you're in doubt as to whether you fall into any of those categories, have a chat with your local GP, because that may be very helpful. There are quite a lot of questions, so do forgive me for just talking at you continuously, but here we are. If a person is immunocompromised, will this make any difference to what age or when they are offered the shingles vaccine and any others? Yes, as I've highlighted above, if a person is immunocompromised, that will make a big difference to being offered the shingles vaccine. It affects the age range you become eligible in. But for flu, if you have a certain health conditions like diabetes or respiratory problem like COPD or asthma, kidney disease, or having medications that might weaken your immune system, that means you're eligible for the flu vaccine at any age. For the pneumococcal vaccine, which I know we haven't really touched on, it's worth saying if you're at higher risk from getting seriously ill, you may be offered it before you turn 65, which is usually the age cutoff for the pneumococcal vaccine. And you may need to have it more regularly to ensure that you are protected. At what age can I get the pneumonia vaccine, and is there a cutoff age limit? It's a vaccine that protects against serious illness like pneumonia, but also meningitis, so chest infection or infection that can affect the brain. It is recommended for people at higher risk of illnesses, so the immunocompromised group that we've talked about, but also it's offered to adults aged 65 and over. There's no cutoff age after that for the pneumococcal vaccine. And if you're at higher risk of getting very ill, you may need to have it on a more regular basis to keep your protection particularly topped up. There were some more general questions about winter health, and I'm just going to come on to those and try and get through them as well.
I'm aware that you probably need a little bit of a breather, Jeeves, and also we've got there are the general questions that you're coming on to, but in the chat there are some COVID-related questions, and I wonder if we could nip over there and address some of those questions, and it does give you a chance to have just a little bit of a breather. The first question, actually, I'm going to ask Lynn to wait until the end, because your question about how we can help as an organization to spread the word about the importance of vaccines is going to be covered by our very own Sharon at the end of the meeting. So if you can be patient with us there. Now, the first question from Grace is actually a very important one. I have had the flu vaccine in the past, but I still seem to get flu every year. Is it still worth it? What is the flu, Dr. Jeeves?
So it's worth saying that the flu virus absolutely is actually an umbrella term for lots of different types of virus that occur. And what we try to do with the flu vaccine is give you some protection from what we believe to be the worst strain in that winter period. Now, it doesn't mean it's not possible to get another strain that may be less harmful, but equally, our objective with giving you this vaccine is giving your immune system a little boost so that when you get this virus, it is less bad than it would have been, that your recovery is a little quicker than it would have been. So it may well be that you've got the strain that we're worried about, but that because of the vaccination, you have recovered more quickly, or that the symptoms aren't as bad as they could have been. The objective being avoiding having to see you hospitalized or have a terrible illness experience. So for that reason, Grace, I would really encourage you to continue to get the flu vaccine, and well done you for getting it each year. And I'm so sorry that you're still getting the flu, but hopefully it's making a difference to your immune response to it and helping you recover more quickly, and reducing how bad the flu might be. So that's question one. Tony, are you going to sort of ask them on the way down?
Yes. Actually, I'm going to read out 2 or 3. How does one know whether or not they are getting a COVID booster because the vaccine providers are not giving this information? I assume that's about the specific boosters against the newer variants. What are the risks and benefits of COVID vaccine? Is the COVID booster available to people over 60?
First one first. Well, we are only supplying ones this winter now that are sensitive to or specific to the winter strain. So if you are getting the COVID booster this winter period, you will be getting one that is specific to the winter virus, because those are the only ones we're delivering, if that makes sense. So unless they're getting some kind of back alley COVID vaccine, which would be very strange, you should be getting the right vaccine that's going to protect you. So I would have a degree of confidence with that. But they should provide you with some information if you request it. That should be happening. And if that's not happening, I would certainly flag that to one of the organizers in the pharmacy, GP, or in the vaccine center that you're getting it in, because they should provide you with the details of what you've had, and it will be documented on your health record, so you can always get a copy of that, because that is your right to access your health record and know what medication you've been given. And please feel empowered to do that if that is what you would like to do.
Thank you. Is the COVID booster available to people over 60? That's a quick one.
Yeah, that's an easy one. So it's over 65 that we're currently offering it to. However, if you have a weakened immune system, which may mean a health condition that you might have, it may mean medication that you're on, then actually we would invite you also to be vaccinated, because it's about identifying those people most at risk and protecting them. It's worth saying as well that if you are the household contact of someone in that category, that you are also eligible. So what I'd encourage you to do is make sure that if you have someone in your home that is not yet vaccinated, it's about getting them protected as well. Because remember, one of the reasons we do this is also to stop transmission, reduce that risk of passing it on to vulnerable people in your home. So I'd encourage you, if you are a household member, if you are a carer, if you live with someone in that category as well, to make sure that you flag that so that you're getting vaccinated. That can be coded at your GP as well, but generally it's widely accepted when you flag that in a vaccination center that we're taking a very permissive approach to getting people in those homes and their loved ones protected. Okay, so just to flag all those different routes. And then the last one was
now this is a quick summary of what you've already been talking about. What are the risks and benefits of COVID vaccine in 3 sentences flat?
3 sentences: reduced risk of hospitalization, reduced risk of death, less severe illness, quicker recovery time.
Brilliant.
Short-term sore arm and some cold and flu type symptoms for a couple of days.
Thank you very much. This is important. I have completed a cycle of chemotherapy 3 months ago and I'm into remission. Is the COVID and the flu vaccine advisable?
It's always worth talking to your specialist to double check, because I won't know the specifics of what treatment you've had and when your next cycle of chemotherapy may be. I'm so sorry for whatever you might be experiencing at the moment with your illness, but it's always worth, particularly with people who are immunosuppressed, getting them protected. But it's worth talking to your specialist to make sure we give them at the right time to get you that protection. So please speak to your specialist.
Yes, get advice. I've had COVID 3 months ago. Why should I get the booster, which is against the same strain that I've already had immunity for? And there's a part B, which is what are the not the short-term side effects of COVID vaccine, but I've had COVID 3 months ago. Why should I get the booster now?
The difficulty is we can't guarantee that you've had that particular strain of COVID. That's one of the challenges in this process. And, you know, as I mentioned earlier, it is a very specific strain that we are trying to protect people against this winter. What I would encourage you to do is to have that to protect you against this BA 2.86 Parola variant, which we are seeing pop up now. You know, I can't guarantee that you had that strain previously when you had COVID. I'm sorry that you had that COVID strain at that time. I hope that having the booster will protect you against further infection, which is important. Actually, the only identified side effects from the COVID vaccine itself are those short-term side effects. We have not seen in any consistent study or trial long-term side effects beyond those that we've identified for you now. What we have seen are long-term side effects of COVID itself. And that is, you know, as has been mentioned, these sequelae, these things like long COVID that many people experience long after they've had the infection itself. And often people will conflate or confuse perhaps the impact of having COVID itself with having the vaccine, and they're very different things.
Thank you. Now we've got two shingles questions, so I'm going to give you both and I'll repeat them if necessary. I turn 66 next month, but I've been told that I can't have the shingles vaccine until I'm 70, even though those turning 65 this year can have the vaccine. Yes, I'm in this position as well, but I know there's an answer, but what is it, please? I've turned 66, told I can't have the shingles until I'm 70, even though the 65s are getting theirs. Signed, I've missed out.
It's yeah, and I'm really sorry. I don't make the rules on these, I'm afraid, and they're usually targeted to risk. But it's anyone turning 65 from the 1st of September in 2023. So anyone that's turning 65 from that point onwards, who would be eligible, as well as anyone 70 to 79 and those 50 and over with a severely weakened immune system. Now, it may be worth checking in terms of your medical history if you fall into that category to try and access that vaccination. There are private solutions as well, but in terms of the NHS, those are our strict criteria for providing that vaccination. But really positive that you're thinking about that and getting winter ready at the moment.
Yes, I'm in exactly the same position, and I know I've got to wait until I'm 70. Right, I am immunocompromised and wasn't offered a shingles vaccine when I turned 50 years. Unfortunately, I contracted shingles over 2 months ago and am still in recovering from excruciating pain. How soon can I have the shingles vaccine after full recovery?
Firstly, Barbara, I'm so sorry. It is such a miserable illness, this shingles is, and I'm so sorry for the pain that you've experienced. It is genuinely incredibly painful, and the pain can last for really quite a long time. Thank you for also sharing your experience, which I hope will encourage other people to get that protection. I feel like every talk I do where we talk about shingles, there is someone in the audience that is better at explaining, having lived it, how bad it is. And thank you for sharing that. I really appreciate that. How soon afterwards can you have the vaccine? It's worth getting local advice. It will depend on your kind of health background, whether you're immunocompromised, your personal circumstances in terms of getting protected. So I would encourage you to have that conversation. And I've popped the definition for when you can have the shingles vaccine in the chat as well to help people that might have struggled with that as well.
Yes, thank you very much for that. That's a summary of what you've just been telling us about the age eligibility for shingles. And everyone, it's in the chat down at the bottom. Now, that's all we've got so far, but we're right on time to get into the Q&A, the more general Q&A about staying healthy. And we have a stack of questions that you've submitted already. Have a quick breather again, Dr. Jeeves. You're doing an awful lot of the talking. And what I'm going to suggest is that you tackle some of the questions that have been resubmitted, and that we invite people to submit, as usual, further questions in the chat. Now, hang on a minute. Someone's asked if we can buy the shingles vaccine if we're between 66 and 70.
Yes, you can. If you Google it, you'll find that Boots and other services will do it for you. So there are private ways of accessing the vaccine as well. But it's always worth having a conversation because, if you can have it for free, that's always nice, isn't it?
Yes. Okay. Now, I know that you've got some questions, not as many as first time around, but much more on general winter health things. And so we can widen the scope of the conversation a little bit now. And thank you, everybody, first for submitting your questions either before or now at the time. It really, really does help to bring out what you're thinking about and perhaps worrying about. And so we can answer some of your questions. So thank you so much for submitting your questions. Back to you, Dr. Jeeves.
Yes, fantastic. Some older people tend to eat unhealthily due to the cost, understandably, and or convenience. Many look at the price due to the cost of living crisis. How can it be better and easier to find these healthy but cheap foods to eat and drink? This is a huge challenge given the cost of living crisis. Absolutely, I recognize this is a difficult thing to do. We always say that cooking from scratch is always best if possible. Trying to eat fresh foods, trying to increase the amount of vegetable that we're eating, but also foods that are really good in terms of sources of vitamins. Really important to try and eat things that are high in fiber as well, because we know, particularly in this age group, constipation and poor bowel habit can be a massive problem. And so having high fiber in your diet can be really powerful. It's really important to stay hydrated during the winter period as well. Not drinking enough is such a common issue and problem. It's so easy to forget over the course of a day to drink enough. So that's a really important part of it as well. It's important to try and avoid food that's high in salt or fat. Often that will be in ready meals and processed food. But there is so much out there at the moment about the health impact of those processed foods and the fact that they're high in E numbers, in chemicals, and low in vitamins, low in the stuff that's good for you. So wherever possible, trying to eat fresh, trying to have food that you have pre-prepared. Even if what you do is pre-prepare and batch cook, you may find that that is better in terms of your health and in terms of getting those vitamins and nutrients. Quite often that's what myself and my partner do. She and I will batch cook at the beginning of the week and find we plug away at that. And that's often a good way of using fresh ingredients, but still kind of creating, if you like, that convenience of being able to heat something up quickly for when you need it. And it's a great way to avoid those processed foods. Another good idea to have is a sort of a big bottle of water that you can take with you when you're moving around the house to remind yourself to drink from it during the course of a day as well. And that's a great way to stay hydrated. I really recommend also, there are some supplements, which I know is a future question, that I do recommend. We know that 40% of the people in this country are low in something called vitamin D. Now, vitamin D is something we produce on exposure to sunlight, and is great for our bones. It's great for tiredness, and it helps with mood. But we're also low in it because there's just not enough sunshine during the winter period. So I'd really encourage you to try and find a source of vitamin D as well, because that's something we know so many people are deficient in and can have a big impact on your health. So a lot about food and a lot about supplements there. What causes leg cramps and what can I do to manage this? Are they a side effect of my taking statins? There are lots of reasons for why people get muscle pains in the legs, including things like restless leg syndrome. Statins can indeed cause muscle pain. I can't say for certain if that's what's causing your muscle pains, and it's really important to see your GP to have a conversation about that so they can rule out some of the things that could be causing it. There are blood tests they can do and look at the timings of when you started your statins to see if they're the problem. It may well be they're not the cause of the muscle pains that you're getting. But it's important they make sure that your feet and your legs are warm and well perfused, that you're not having them go pale or cold or pulseless. And if any of those things happen, or you lose feeling or power in your legs sometimes, it's really important to see someone straight away to get that looked at. It's very hard for me to comment on the specifics of your muscle pain because I've not got your medical history in front of me, but I'd really encourage you to talk to your GP to do that. And I think I've just tried to highlight a few big risks in case you needed those to hear those as a prompt to see someone. Okay. What is the best way to keep healthy this winter? We've talked about this and I mentioned it in my opening. It's eating well, it's drinking enough, it's keeping warm, all things that are so difficult in a cost of living crisis. But the other really important thing that I always try and hammer home in these talks is being connected. It's such a big part of this is talking to other people. It's interacting with friends and neighbors and family. If you are, fortunate enough to have access to those things around you, it's calling each other and having conversations. It's seeing people, because I think that loneliness and lack of engagement are such a massive problem. And that's why some of the work Age Concern do is so powerful. It's so important to help you connect with one another. Not just kind of sitting here and having to endure listening to me talk about things, but actually being able to see each other on each other's cameras and have conversations and go to some of the wonderful events that get put on, because that's a really powerful thing about not just staying healthy, but feeling well. And I think that's often poorly understood. And obviously, my answer is also going to include getting vaccinated. against COVID and flu. So please do think about doing all of those things. And that's my general guidance on kind of winter health, really. How can we support disabled people to stay healthy? Well, it really depends on the person, this disability, the disability this person may be suffering with. And it's important that engagement and support and conversation is key. I think if you're in doubt about how to support someone, the best thing to do is to ask them and try and see what help they might need during the winter period. And, usually people are much happier when you have that honest conversation from the point of view of wanting to help them than perhaps assuming or not knowing. So I'd encourage a conversation with that specific person in their context. All of the things I've described above really apply. They're about staying connected. They're about staying active, importantly, and about trying to eat well, drink well, and do all those other things I mentioned. Will the new anastrozole cancer drug be given to the over 65s who have previously had breast cancer? So I got to this question, and I must say, I do not know, my love. And I've got to be really upfront and honest about when there's a question where I don't know the answer. For those that don't know, there was recently a big launch in the news of the fact that there is a medication that they believe reduces risk of breast cancer. It's a fantastic announcement. We don't have the wraparound guidance yet as to how that's going to be given, how it's applied, who it will be used for. So I don't have a clear evidence-based answer for you. And so whenever that happens, I try to be very honest with you about the fact I don't have the answer. If I can find it, I will provide it to you, but I don't have that guidance as yet. And I think many healthcare professionals are waiting for the guidance around that to come out so that we understand how it's going to be used, when it will be used, and for whom. It's important that patients are communicated with in their preferred format. If a letter in large print or braille is required and does not happen, appointments can be missed, and sometimes people are taken off GP lists. This is a national issue. Is there a special helpline for this? Well, look, I massively agree with you that we have to communicate with people in a way they understand, or what is the point of having sent the communication in the first place? And if you have a need for braille or large print, that should be acknowledged and understood in your health record so that we're communicating with you in the right way. And if that's not happening, it's worth flagging that to make sure that happens in the future. Sometimes these things occur and problems happen. I would really encourage you to call services when this happens and explain the situation. I would really encourage you to flag those things, because it isn't okay or good enough if you're not getting communicated with in an appropriate format. That's why groups like Age Concern are so fantastic, because they do huge amounts of lobbying on these issues, and it really helps organizations sometimes wake up to when there are problems with this so that you're getting what you need. And I'm really sorry if this has happened to you. And I hope my answer tries to help. I recognize this is a problem and we need to do better. And a big part of that is making sure it's clear in your health record so that people send you information in the right format that you need. How can one improve their breathing problems? So this really depends on your breathing problem. I would love to give you more specific advice, but it really depends on your respiratory health condition. It may be about the medication that you're on. It may be about the environment that you're in. We know that things like mold in living environments can be really detrimental to breathing, and that's something I'd really encourage you to be wary of. I sort of can't answer beyond that. We know air quality increasingly is a massive issue, particularly in London. So those are all factors to think about. But I would say if you have specific worries about your breathing, it's really worth seeing your GP just to make sure that you're on the right kind of setting of medication, etc., depending on your health problems. How often and how fast should I walk in the winter now that I am 75? So I think you should walk as often as you can, as fast as you feel safe to walk, and as far as you feel comfortable to walk. It is so important that you continue to exercise and stay active, because it is about using what you have to keep it at a certain age. It is about staying as active as you can to retain your mobility, and it will improve your kind of health and happiness to do those things. It's worth saying as well that the distance that you travel, you will burn the same number of calories and you will derive the same benefit whether you're walking or you're running. So for me, it's not so much about the speed, it's about the activity, it's about the time that you spend, and it's about the fact that you're doing it. So please continue to do that. I love that as a question. How fast should I walk now that I'm 75? The other thing to factor in, obviously in the winter period, it is very icy out there. Please let me encourage you to take particular care that you're wearing appropriate footwear, and that if you need walking aids or other support, that you really do that. I really encourage you to walk in groups with other people, partly because I think it's safer to have that support around you, but also just because the company is such a fantastic thing and really great for interacting with other people. And I can see Jerry's dropped a recommendation in the chat, which sounds very good, and I might have to Google myself after this. Is it a good idea to take certain over-the-counter vitamins with prescribed medications? Yes, it really depends what they are. I think I wrote in my own notes, this is mysterious without specific without specific information. It really depends on what we're talking about. There are many things that can interact with medication, but things like vitamin D, vitamin C, etc., can be really positive things to take. They can have a massively positive impact. As I mentioned, vitamin D, low in so many parts of our society and population. So I'd really encourage you to use those if you find that they derive benefit for you. But if you are in any doubt, it's worth talking to your doctor, because some additives like St. John's wort are actually medications that can have an impact on the medication you take. So it's worth just flagging if you're taking something like that to talk to your GP to let them know, because it may affect the dosing of your medication. That actually brings me to the end of all of the questions that were submitted that Sharon so kindly compiled and sent to me. I hope that answers the questions you gave me. And Tony, I'm happy to take any others that you have.
Yes, and we don't have any more apart from that recommendation in the chat you just mentioned from Jerry. We don't have any more questions. So I'm going to encourage people to ask away, please. I want to say that when I retired from paid work, I gave up my car, which I could afford to do because public transport was good enough around me. And I've really enjoyed walking much more as a result. And some people find it terribly boring. I find it quite joyful because I'm out there in the streets, I'm seeing what's going on, and I'm getting that warm, fuzzy feeling that I'm doing my heart and my brain and the whole of my body some good. So it's really excellent. And I've got one of these clever watches that tells me how much exercise I've taken. And when it gets to 30 minutes a day, it doesn't give me the thumbs up, but I give myself the thumbs up instead. So that's it's such a simple way of getting exercise too, but you've just got to be careful about staying safe and stick if you have balance problems. And certainly it's been icy this morning, and being really careful when it's slippery. Are there any more questions for Dr. Jeeves? We've got bags of time if we need it. We are going to have Sharon coming back to our very first question at the end. But if there are any other questions, can you put them in the chat? Or are we going to leave it there?
Well, can I just say, just as a sort of plea to all of you, and thank you for making the time to come to this, because it's so appreciated, not doing this to an empty Zoom room, but also because as much as I can kind of get out there and try and talk to people, nothing is as effective as you telling your friends and telling people that maybe didn't have the opportunity to be here. So please, there will be a shareable version of this that you can share if you choose to. I know that Sharon's going to share resources and content with you, but please have those conversations with your friends, with your loved ones, to make sure they're getting winter ready, because winter is it has the potential to be such a great period, but it's also a period where people are at so much risk. And it's so important to try and avoid being ill during this period, because it can be just so miserable. So please do have the conversation with them to make sure that they're eating well, drinking well, doing all those things, that they're seeing people and having interaction and not feeling the loneliness of the winter.
Yes.
And also, please spare me a thought in this process and encourage them to get vaccinated. Okay. Thank you, guys.
All right. We've either stunned you into silence, or we've answered all your questions possibly, or maybe it's a mixture of the two. We could, Sharon, we can go on to you now if you want, and if people still do have any questions that you can think of, please pop them in the chat, and we can come back to them. So what Sharon wants to do, Sharon is our campaigns engagement officer, and she is very good at engaging people in our campaigns and wants to talk to us about all the resources that we have as Age UK London, and in terms of publicity for our Staying Healthy in Winter. So Sharon, if we can, someone's popped a question. Can we come back to that question at the end? And Sharon, can you kick off with your publicity stuff now?
No problem. Hi, I'm Sharon from Age UK London. Some of you will have recognised me from many events over the years, and in person and online, etc. So just to say again, this winter we're promoting and encouraging people to stay healthy and active and all of those things that Dr. Jeeves has been informing us about. Eating healthily and keeping hydrated and keeping warm, obviously, which is quite a difficult thing. I'm here with a nice blanket over my lap, actually keeping myself warm at the moment. So I think it was it Nuala from the South London and Maudsley asked about how we can share this information. So what we've got at Age UK London is we have resources like, we have these double-sided little leaflets, they're very small A5 leaflets, which give you just a little information about ensuring that you have booked your vaccination. There's one of these fancy little QR codes. If you're tech savvy, you can put your camera on it and it will immediately take you to the NHS website where you can book online to have your vaccinations. Also, it gives you the 119 hotline, as we were told about earlier. So you can call that 119 number to book your vaccinations, or you can walk into your local pharmacy and ask whether they're giving vaccinations or not. And again, it's just got the eligibility for older adults. Now, obviously, there are people who are pregnant, people, young children are also eligible for these vaccines, but we're only focusing on older adults on this leaflet. So it's not that they're not eligible. You can get them from me. I can send them to you. I will also, in the follow-up email that I will send to all of you that registered, there will be a link to our website where you can also download or share the leaflet. We also have a similar. This one is a poster. It's A3 size. And this one can go up if you want. I know that local community notice boards have space for stuff. Church halls, mosques, synagogues. There's a lot. Faith spaces are usually happy to put up some posters, etc. Or local supermarkets often have community spaces and notice boards. We're also, if any of you are part of like an older people's group or your local residents association, any sort of local group like that you're involved with, if you're looking for a little blurb to put in your newsletter, we're more than happy to give you a small piece. We can write a little piece for you just to encourage people about the, staying healthy in the winter and encouraging people to do that. There's also lots of other links that I will put in the follow-up email, especially for things like community languages, where people are not aware of what is available for them. I know that the Mayor's Office and the GLA have little short videos, and the NHS websites have them also. So rather than actually having written information in language, because sometimes this can cause an issue, some people can speak a language and not necessarily read it, whether that's English or another language. So again, having videos is always a very good thing, and I can share those clips with people. So I think that there's a lot of resources that we're very happy to share. Again, I will send them. I'll send everything in a follow-up email to all those that registered. And please reply to me if you want some, how many, and the address that you wanted to be sent to. And I will get them all sent out over the next few days, once depending on how many you all want, basically.
That's super. Thank you so much, Sharon. So Sharon is your resource center if you want to order any of this publicity. And if you or your organization wants some, please stick it up where people are going to read it. Thank you so much. I want to remind people that Sharon, what's the deal over the evaluation forms? Have people already got one, Sharon, or are you going to be sending those out too?
Oops, no, let me do that right there. Where am I? Yes, I put myself back on the screen so you can see me. Yes, I will have evaluation forms that I would send out also. Again, they're Word documents. You don't have to, I can put them in as a question. Any response, any information, any feedback. If you feel you can't fill in the form and it's too tricky for you, and you just want to reply to me to tell me any feedback about the event, it's more than welcome. Positive or negative, it's always worth knowing how you feel about it, and how we can make things better, or what worked well for you or what didn't work well for you. And I also will have a little link to a survey which is completely anonymous, just asking, it's like an equalities monitoring form, so that we know that we're reaching out to people across London and we're reaching out to all communities.
And can I just underline that importance of feedback? We take the feedback very seriously, especially when it's on Zoom, but also when we're in face-to-face meetings. It's really important that we know what works for you and what doesn't work for you. So please don't hold back. It's all appreciated and welcomed and taken note of, more to the point. Okay, right. Now, Jeeves has actually answered the question about children and having the COVID vaccine in the chat, if you want to pick up on that. Are there any other questions? Because if there are not, we can leave it there. Sharon, you wanted to say something?
I have a question for Jeeves, actually. I know in the past, we were told that it took about 2 weeks for your flu jab to kind of kick in and give you proper total, like your armor. It took about 2 weeks to almost grow after you had the vaccine. Is that still the case? Is there sort of, so some people say, oh, I got the jab and then I got the flu, and I remember that kind of 2-week period. Is that still the case? Am I saying something wrong?
No, not at all, Sharon. It does take about 10 to 14 days after the vaccination before you see the immune response and protection develop, speaking quite broadly about vaccinations like flu, for example, which is why we try and start the immunization process at a particular point to make sure that your protection peaks during the period at which you are most at risk. So that is why we start it so much earlier usually in the kind of November or sort of October-November period, to try and make sure that people's protection peaks at the right time. So you're right, 10 to 14 days is what we would normally say before you reach that appropriate immune response and protection.
And that leads us very nicely onto the question that's just appeared in the chat. How long are the protective effects of the COVID vaccine? How long does it last?
So it will depend person to person, which is why I think we look particularly at people with particular medications or health conditions. So for those that are immunosuppressed, we know that the protection lasts less long, which is why we top it up more often. Our understanding is that our patients beyond a certain biological age, so our older patients also, may need an additional bit of protection against these strains, which is why we're specifically targeting and protecting them. Now, that's not to say that you won't get a good level of protection for a good period of time, but what we do is monitor also those strains and changed types of virus that emerge, because it may be you need an additional boost to protect you from them. Now, that's not to say that the COVID vaccines, the primary course, won't still be protective for you against many of the strains that have been, out in the world so far. But for this particular new strain, actually your immune system may need that extra bit of protection to stop you getting as unwell as you might have been in this winter period. So that's it's a slightly vague answer, because it really depends on your personal circumstances and your constituency, but I hope that that's helpful.
Thank you. Yes, it does depend a lot from individual to individual. I had a conversation with someone back in the summer who was furious that she'd received a booster and then got COVID 3 months later. And, that's bad luck, but it does happen. And everyone seems to vary. Some surgeries are offering...
And importantly, Tony, it may mean that the severity of the COVID that they had following that was reduced in how bad it was, right, and that their recovery time was quicker because of the vaccine.
Thank you for making that point. That's really, really important. It meant that she didn't have to go into a hospital, maybe. Yes.
Finally, can I ask a question?
Hang on a minute. There's somebody on the phone who wants to ask a question. Can we take the person on the phone? Can somebody unmute her? And
which person was? Where's the person? Can you say your name?
They're muted.
The person who wanted to ask the question.
Yeah, they're muted at the moment. If they just unmute themselves, then.
Hello. I wonder whether you're talking about me. I'm not sure how this mute and unmute button works. Can you hear me?
We can hear you. We can hear you. I know some people aren't able to use the chat, so it might be okay now to open it up a little bit more.
All right, I'll be as quick as I can.
Thank you.
I'm 79, turning 80 in about a week or two. Am I still eligible for the shingles vaccination? Because what you've told me this morning really does trigger my interest in that.
Absolutely, sir. What I would say to you is it will depend on your circumstances. It will, I suspect, for you be about the strength of your immune system. So it will be about your medical conditions or the medication that you are on that will determine your eligibility for the NHS shingles vaccine. You can always check that via your GP to make sure you're eligible. If you are ineligible for the NHS vaccine, that does not stop you getting protection via a local pharmacy who may well give that to you for a small charge. So those are sort of the options available to you, and a Boots or a local pharmacy may well be able to give you a shingles vaccine for a small charge outside of the NHS, if you like.
If you can get in there before your birthday, if you get in there before your birthday, you might get one for free.
Yeah, thank you for that. My wife is sitting next to me. She's a couple of years younger than me, so we will certainly go in for her, and I will see what I can do about it.
Well done. Thank you.
Sharon, it's Carol.
Carol, do you want to ask your question now?
Yes, darling. I've been trying to ask for about the last 10 minutes, but I hope you can hear me.
We can
Sorry
hear you.
I'm late. Sorry I'm late. My heating had gone off. Just to ask you a couple of questions. One is, why have I had to have 8 COVID injections? Because I suffer with asthma and COPD. I've only got it mild. Why is it that I have had to have 8? Have I got to have any more? And why am I so weak and tired with a flu as well injection?
Carol, is that eight vaccines since 2020?
Yes, since 90. Yeah, I have
Over
to
the
keep
last
having them.
3 years?
How can I speak?
Yeah, I've had eight COVID injections. 8.
Well, that would, yeah. Doris, you'll be next. If you just hold on, I can see your hand. Carol,
And the other question, I want to ask him. My son, his father was Jamaican, and he had the AstraZeneca injection when they had it come out. And my son has never been well since he's had that injection. Is it because he's a different culture and it's affected him more? He's always tired and he's got no life in him, and he's a 42-year-old man. And I'm worried about him, okay? Thank you very much, Sharon. Thank you for that.
Carol.
Right.
So, Jeeves, I think the idea that she has, I think it's the 2 vaccines and all the top-ups. So I suppose she's wondering why so many.
I suspect she's probably also including perhaps some of the flu jabs as well in that period,
Yes.
thinking about the numbers that she's describing. Carol, I'm really sorry that you're having to have all these jabs. I guess part of my talk was about the fact that the reason we do these boosters is when we look at the risk that you have, particularly if you have asthma or COPD, which are breathing conditions that are about your lungs, or if you're on medication for your lungs that might include something like a steroid that weakens your immune system, it means that you might be particularly vulnerable to new strains of these viruses. What we know is that over time, these viruses can mutate, new versions of them, if you like, develop and start to spread. And some of them are particularly infectious, and some of them are particularly harmful. So the reason you have the boosters is when we see that one of those strains is spreading a lot and causing a lot of harm, we check the vaccines we've given to see if they protect you from that additional strain. And if you need a top-up of your protection to protect you against that particular new thing, that's why we offer a booster. And every winter, particularly for people with the health conditions you've described, because we know they're at greater risk of ending up in hospital or being very unwell, we offer those boosters. Now, that doesn't mean you're not going to get offered a booster again in the future, my love, because actually it's about trying to keep you safe. And I'm sorry for the inconvenience of that, but the idea is that it tries to stop you ending up in hospital again, or at all, or indeed having a worse infection than you might have had. I hope that answers the first question. And the second question that you mentioned was about your son, who'd had the AZ vaccine, but also has been feeling tired ever since, and perhaps having long-term side effects is what you're describing. What we quite often find is that people end up having COVID, and they have a condition that we call long COVID, which is where they feel exhausted, they feel tired, it's hard to do exercise, to find energy to do things thereafter, and it's well documented at the moment in people that contract COVID. We know that particularly people from minority ethnic backgrounds, you mentioned your son being partly of Jamaican heritage, particularly our Black and minority ethnic communities, people from Asian backgrounds who might have more health conditions or comorbidities, are even more at risk than other people in society. So because of that, it's particularly important they get protected, because quite often we see that they will have not just really bad illness, but also that they're at higher risk of terrible health outcomes. One of the things we saw in areas like the area I work in Hackney, was that people from minority ethnic backgrounds were more likely to end up in hospital. They were more likely to have really bad outcomes from COVID, let alone flu. And we think that's partly to do with the kind of health background around them. And that's why it's particularly important we try and protect them. What I'd suggest is that it's unlikely that it was the AZ vaccine that caused this tiredness thereafter. It may well be that your son contracted COVID, and this long COVID, this terrible illness that many people have, happen as a result of the infection. I would hope that the vaccine to some extent reduces the severity of the infection, reduces the infectiousness, and hopefully prevented a worse outcome. But it doesn't mean that you can't still get COVID. It does not mean that you can't still have some of the bad outcomes that people do have. And we know that that's more common in particular groups of people, which is why we make a particular effort to try and help them get protected, because more often than not, these are the same groups of people that often don't get vaccinated, that don't get that winter protection that they might need. I hope that answers the two questions.
Yes, that
Carol.
does. Thank you so much. Thank you, Sharon, very much, darling. It's really answered that now. Thank you very
No
much.
problem, Carol. Thank you. And Doris, you've been waiting patiently. If you want to unmute yourself, you need to unmute. We can't hear you, Doris.
Can you hear me
There
now?
we go. We can hear you now.
Yeah, sorry, I have tried to submit by chat, but somehow I can't do it. And I also submitted my 2 questions to somebody called Sharon by email. Anyway, I've got 2 questions, please. I had shingle and pneumonia vaccinations about 8 years ago. I was told that you can only have that once. Is that correct? I'm now 77.
So for most people, you will only need to get those vaccinations once. For
Once
people
in your life.
so for some people that have a weakened immune system, they end up having to have more pneumococcal vaccines. But if you're unsure or you need to check, it's worth talking to your GP to make sure you're not one of those people that maybe needs a top-up of vaccines. Usually, if you are, we'll contact you and let you know, but it's always worth checking, my love.
Is that for pneumonia?
For the
And or
pneumococcal
shingles?
vaccine particularly,
Yeah,
if
because
you
I have
are
a breathing problem.
immunosuppressed or if you've had specific healthcare treatments, sometimes you need to have
Right.
another dose or a top-up medication. So it's worth just checking with your GP that you're not one of those people. But otherwise, if you've had your protection, you should be protected now.
Okay, I probably. And my second question is regarding COVID. I've tested negative on since the 4th of November after having tested positive for 27 days. Also, I didn't really feel very ill. When should I have the vaccination, or?
Yes.
And if so, when?
Normally we say 28 days after infection. So if you're on day 27, you could book it. You know, you're in a good place to do that.
I should still have it, you think, yeah?
That would be my advice, is to still get protected for the winter strain to come. And, you know, obviously, congratulations for not being so unwell the last time that you contracted.
No, I wasn't.
Yeah, I mean, I think the thing to say is there's no guarantee the one that you had wasn't one that you were already protected for and perhaps helped your immune system respond to that. What's important is that you're protected for the winter one. The only way to guarantee that you have that is to get your winter vaccine. And I'd encourage you to get your flu vaccine as well, either alongside it or...
I've had it. I've had the flu.
Oh, very good.
I've had the flu, but I didn't want to do anything about COVID because I wasn't sure.
Yeah, well, look, Doris, so far, A star for you. And, you know, book the next vaccine and then you're covered.
Okay. Thank you very much.
Thank you very much indeed, Doris. So a question has just appeared in the chat. Can you please advise if a person should get a shingles vaccine, especially if they've had shingles in the past? I've been told that you would get shingles again if your immune system goes down.
Yes, so we would advise kind of getting the shingles vaccine for protection. It may be that you've had shingles in the past. I think if we're talking about your immune system being immunocompromised, it's always worth just having a chat with your GP and checking depending on your personal circumstances. But you know, we would advise you getting the shingles vaccine if you are eligible to have it. Yeah, I think that's covers that. And even if you've had shingles, you can still get the shingles vaccine to help prevent future occurrences of the disease. So yeah, that would be absolutely fine to do that.
Thank you. I hope that's clear for you. Are there any other questions? It looks like we've run out of questions, but we've done really well today. And I say we've done really well. The person who's done really, really, really well is Dr. Jeeves for fielding all these
Sorry,
questions.
I'd just like to ask one question. This is very urgent. I suffer with shingles. I've gone blind because they couldn't catch I was always short-sighted. I've gone blind with shingles in the left eye. So I want to know, and I've got it for life, will I ever get shingles? Because I got shingles. Will it occur now? Will I get it again, or is this for life? Because I've got it for life now because I've gone blind in the left eye and I've got macular degeneration in the right. So both eyes are going bad. But as I say, I went blind in 2015. So I've got it for life. Is that right when the doctor told me that I've gone blind in the left eye for shingles?
Carol, it's very, I'm so sorry, my love, that this has happened to you, because that sounds like an absolutely awful experience. I can't say for certain if that's the case, because I don't know your medical history or when you contracted the shingles, etc. I think it's always worth talking to your doctor, your GP, to kind of have a chat about that. But there are, you know, increased chances over time of getting shingles again after you've had it. So, you know, studies have found that, you know, over a period of time, your odds of getting it again increase. And it's really important, even if you've had shingles, to make sure you have the vaccine to try and prevent.
No, I've got it in the system, doctor. I've got it in the system. I don't need to have the injections. I've got it in my system for life now. So I will never get rid of it. Yeah, I've got to live with it.
I'm sorry
Carol,
for that, my love. I'm afraid, yeah.
Carol, I think what Dr. Jeeves is saying, though, yes, you have it in your system, but in order for you not to get sick from it again, I understand that it would be important to have the shingles vaccine.
Yes,
Yeah,
that's
I'm all right.
what I understand, Carol, that you should have the shingles vaccine.
Some people have after effects with that injection. That's the reason I won't have it. But I'm fine. I'm okay. I'm living life to the full. I'm full of life.
You certainly are. I've seen you out and about at many events and at positive aging in London events. You're an amazing. You're always out and about getting involved.
I'm now on the Positive Aging in London, the age friendly. I'm their secretary.
You
now,
certainly
Sharon.
Are. You're fantastic.
Yeah, thank you. Thanks for that. Thank you, Doctor, very much. You've made me happy today with all your answers, particularly about COVID.
Yes.
Thank you.
Carol.
Thank you, Carol.
I'm sorry I'm late. I'm sorry I'm late, but I would like to ask one question.
Yes?
Me and my wife never had a single injection or vaccination before. Is it advisable to take it?
Sir, absolutely. And I'm sorry that you've missed, I think, the talk that we were giving. I think there'll be a version that you can watch back, which will talk about all the reasons why. It's absolutely a good thing for yourself and your wife to get vaccinated against COVID, but also against the flu in the winter period.
No, we had a COVID vaccination and a flu vaccination.
But shingles.
This month, yeah. But the shingles, I'm asking for shingles.
Yes, I put the criteria for shingles up in the chat. I'll repost those in case they're helpful. But if you fall into that category, it's absolutely a good idea to get protected against shingles, because it can cause such huge problems, as we've just been hearing about from Carol, and we heard earlier as well, I think, from Bhavna. It can be a really terrible illness. So I'd really encourage you, if you're eligible, to get vaccinated against shingles.
Yeah. And what are the side effects?
So the side effects are the same as with the other the other vaccines that we've described, which is that you can get short-term, very sore arm. You can have a feeling of tiredness, of headache that can last for 24 to 48 hours. And that's quite common in people that get those. But there are things you can do to protect from those side effects. So, for example, taking, if you're able to, paracetamol or ibuprofen beforehand, or using things like a hot water bottle as well beforehand, but also afterwards for the 2 days, can help to protect you from some of those side effects and symptoms.
Okay, thank you very much.
You're very welcome, Mr. Desai.
Okay.
All right.
Just
I'm
one-
just
I'm
yes,
just thinking,
Sharon.
if you are over 79 and you have never had a shingles jab, and the eligibility says up to 79. So let's say I'm 81 and I think maybe I need a shingles jab. Is it then too late, or is it, do they, you know, what can happen then?
So currently, I think you're eligible until your 80th birthday for the shingles vaccine, but you'll continue to be eligible if you have a weakened immune system. So that includes a number of different health conditions and medications. And, you know, we offer it up to that point in your 80th year. And, you know, you can still access it privately. There's still clearly some benefit. But currently the NHS offer is up until 80. And that's the information on the NHS website and that I've shared in the...
Brilliant. And
Oh,
sorry,
my real age is 85, so I'm not eligible then.
but it might be worth speaking to your GP, I suppose.
Yes, because if you have certain health conditions or are on certain medication, you may still be eligible, but as an alternative, you can access it privately via your local pharmacy sometimes, if it's something that you're worried about.
And there was one other thing, I'm very annoying, sorry. One other thing I wanted to ask. I know this word, and it was, we were told that the over 65s flu jab is an adjuvanted vaccine, and is that right, that I understand it actually boosts your immune system slightly?
Yes, it boosts your ability to respond to the vaccine.
Is it just that vaccine as opposed to just boosting your immune system in general?
I think it's just the vaccine, that vaccine.
Okay.
Yes, Tony's on the money there, on the money.
Thank you.
Okay, any other questions?
Very good.
I think that perhaps we should wind up the meeting there. I want to thank Dr. Jeeves so very much for being really on the ball with all these answers to questions that you've submitted, and for being so clear with the answers. That's really, really important and responsive. So you've been brilliant. Thank you so much. I also want to thank Sharon and Dom from Age UK London for setting up the whole meeting and all that work that goes on behind the scenes that we never get to know about. And to all of you who've taken the trouble to attend and send your questions in and for taking part. Thank you so much, everybody. It's been a really interesting meeting. And I always come out of these meetings that I've chaired quite a few now, really buoyed up because they're so interesting and there's such a lot of energy around and interest. So thank you so much, everybody.
Can I ask you a question? Is there any way that this is recorded that I could
Yes,
get a...
it is recorded, Carol. It is recorded. Sharon will be telling you about
my son can listen to it.
Yeah.
I'll be sending you, I'll send you an email, Carol, with all the links and everything.
Oh, yeah. And a recording of the meeting.
I'll send the recording separately to everybody, not a problem.
Thank you very much. Thank you so much for your expertise today, and lovely to listen to a doctor and understand that I can give that to my son tonight and tell him he'll be happy. So that'd be good to know. And if you got it on recording, he can listen. So
Good
that
to
will, steady for him.
Sure can. So thank you, everybody.
Thank you very
everybody,
much.
for all your contributions. Thank you so much.
Thank
You
you.
are also, thank you very
Thank
much.
you.
It's
Thank
good
you
to have
very
Bye bye. God bless you all.